Hi everyone, I'm Nataly Youssef, and I am the CEO and co-founder of My Health, and we're building a product called HealthTrace. For short, HealthTrace is meant for healthcare, but what I want to talk to you about is the elephant in the room. Guys, our healthcare costs are on the rise. This CNBC back in August has basically done a study, and they are expecting our costs at the individual level to be $15K by 2023. Just to put that in perspective, more than 75% of Americans have less than $10,000 in their savings account. That's a big number, okay? I want to ask you around here, anybody who has gone for medical service knew how much it would cost before they've gone to service? Anybody here who has bought a plane ticket knew how much it would cost before you bought it? So in the past few years, we have been hearing about healthcare consumerism. We are healthcare consumers. We're no longer just patients. If I am a consumer, I do not have a visibility over a product or a service that I'm buying. And that's becoming more and more of a big hurdle for us users of the system. We're not the only ones, though. A lot of us are getting our health insurance from our employers. Large employers, the Amazons of the world, are actually your insurance company. Your healthcare bill is on the rise, their healthcare bill is on the rise. And in fact, with all that they have done, including introducing high deductible health plans, all of these shifting costs to the consumers, at the end of the day, they're looking at what they have done and what this has done to them, and really their cost has been rising at triple times the inflation rate. So we are in for a big problem. We believe with my team that really the solution lies with us, okay? There's a lot of solutions out there. There are a host of players trying to help employers, host of players helping providers, host of players helping the insurance company. Patients are out, but then if we are armed with information, I think that we can help the system and we can help ourselves. So we're introducing HealthTrace. HealthTrace is a fintech play on your healthcare. We're your personalized financial advisor around your healthcare. What do we do for you? Well, we help you save on your healthcare. We help you manage your finances, your medical bills, and we help you gain an understanding really simplified to one action at any given point in time. And that's all that you need to think about and hopefully act upon. Features. How do we help you save? Well, in a number of ways, although this is really brought to your attention, personalized at the time that it matters the most. Save on taxes. A lot of us have health savings account. 25% of health savings accounts are not funded in the US. This is how you should be paying for your medical bills. Otherwise, we should deduct that from your income. Save on care. We help you estimate the price before you go to service. Save on claims. A lot of employers do offer us voluntary benefits that could actually help us get some cash reimbursements on some of our medical bills. And finally, save on coverage, and this is really forward-looking. Are you in the best health plan? Let me try to give you a short demo. Oops. And I'm going to try to talk it over. And the nice thing is that this is timed. So, this is your health purse. we're concentrating on one action item. In this case, we have realized that some of your medical bills have not been paid by your HSA. Your total spending for the year was $11,000. You've had quite a year, actually. Your daughter had lymphoma. This is your bill. This is what you paid for. You paid 100% and you paid a copay. But your health savings has still $14,000 that you haven't used to pay that $11,000 for your family. So as a result, this is where we help connect the dots. This is really kind of your healthcare bank account. We also help you file claims if needed and if applicable. I want to move over next to searching for care. So brain MRI, I've done my brain MRI when I was at MIT. It costed me $50. When I went back for a checkup, it really costed me $1,500. So at least you would know ahead of time how much it's estimated to cost, and you really would shop. You're a healthcare consumer. Third, you can upload your documents, get organized, especially if you're getting a lot of healthcare bills in the mail. Quick note, don't pay your healthcare bills right away because some of them will get pre-adjudicated, so you should not be doing this. And then you get to save them, you get to keep them, and obviously any other expenses around your care. This is your feed. This is everything related to your care. Your bills would show up, your charges would show there, as well as any action items that you have done from the action list that we've given you. And this is us. Any questions?
Just on that bill uploading thing, is the app able to like automatically, kind of deduce what's going on, or figure like read what's going on and say like this is the service, this is the cost?
So EOB's explanation of benefits are easier because usually there's a code, then there's a line of item of how much it is in total, then there's a line of how much the coverage pays and how much you pay. However, you can upload your rental. So a friend of mine currently has tumor. She's living in Dallas. She's at NYU, and she's paying rent, and all of that is tax deductible. So you can upload really anything. So you can say what you're uploading, and then we don't OCR everything. Yeah, but some of it is OCRable. Any other questions? Yes?
Where are you getting the pricing information from?
Okay, great question. Thank you for asking this. So we're partnering with large employers. This is why I kind of slipped them through. Large employers are insurance companies. They use Blue Cross and Humana just for their plan design, not their plan design, their network, the negotiated prices. But they could allow us to get a data feed on the claims. And so this is where we get it from.
So you mentioned HSA funding, but those accounts are relevant for taxes, so you can use or not use the HSA if you want to, right?
Exactly.
Now, so in all the plans have this distribution opportunities in their own website. Why use your product and not just Fidelity product?
So what we give is not just a snapshot of where you are. We give you advice. We tell you that you haven't, there are these charges. You paid them through your credit card. You could have paid them through your HSA. And if you did not, please deduct them as a medical expense from your tax return. So we give actionable items. We're not just showing you your data. And then your data also lies in so many places. So you've got an HSA portal, then you've got your Blue Cross portal, then you've got, if you have an AFLAC voluntary benefit for hospital coverage, and you have to deal with them. So things are really in silos. Then you've got also your healthcare bills that are coming in the mail. So there is a bit of basically being siloed. And then if your employer next year changes to Humana, now you have Blue Cross from the past, Humana for the future. Instead, this just stays with you.
So are you saying one of the primary benefits is you'll
make the whole HSA process less scary for people that don't know, that aren't familiar with them. And
Yes.
then when they have it, they'll make sure they leave nothing on the table.
Exactly, exactly. Example, my husband, who he knows what I'm working on, just got an x-ray. He didn't ask me to tell him where to get it. This is in closed beta currently. He paid $450 for his x-ray, paid it from his credit card, and was complaining that this month we've just overpaid in this x-ray and this doctor's bill. And I look at his HSA, and BU just gave him $1,000 as his employer. Pay for your expenses from this. It's so easy. And he is he's a postdoc. He is a quantitative kind of guy, but he just doesn't understand and didn't understand that the HSA actually rolls over from year to year, because FSAs don't. So,
Thank you.
Thank you.
thank you.